Hi friends, good evening. Today we'll be seeing a case of patient who came to our IVF center. So this was her ultrasound picture. Now I want you to focus on the picture. And the patient who came was a 26-year-old female who had been married for 2 years, and she was coming for the evaluation of primary infertility. She did have complaints of severe dysmenorrhea during her periods, and besides that she wanted to have a baby, so that is how she came to our IVF center. So now upon ultrasound what we saw was these two structures, if you see, right? So what are these structures? What is this? So these, if you see clearly, I would give you some time to guess what these are, and then you could also tell me what this, and then of course you can see this structure, this endometrial lining, right? So yes, this is the case of kissing ovaries, and this is the uterus with the endometrial lining. So basically both the ovaries have come together in the POD and they are very closely approximated, or they can almost be touching together, and hence the name kissing ovaries, because they are so close to together they are almost kissing each other, right? So why does this happen? Now, this is generally why, because this is seen mostly in a case of endometriosis, and this happens because what happens is there is bleeding that happens repeatedly because of the endometrioma in the ovary, right? There's endometrioma in the ovary, so there's bleeding in every period, and the bleeding repeatedly leads to inflammation and also adhesions. So the adhesion pull these ovaries together. So basically, these repeated episodes of bleeding causes adhesions, which cause the pulling of ovaries towards the midline. And these ovaries are generally pulled down into the POD, pouch of Douglas. So that is why kissing ovaries. So kissing ovaries is basically a sign which refers to the appearance seen when both ovaries are located or are touching each other in the pouch of Douglas. So this is our pouch of Douglas, and that is where the ovaries are located. Most commonly seen in severe endometriosis, as I said. Besides that, it can also be seen in the case of PID, right? And that presents with pyosalpinx or pelvic abscess. And to differentiate between the two, what we can advise the patient is an MRI, right? So this was a complete picture of those kissing ovaries. It was an interesting case, so I thought why not show you people what is kissing ovaries. So if you can see it again without the animation, the two ovaries coming together in the pouch of Douglas, and this is the uterus and the endometrial lining. So I hope this was informative and a short class on what is kissing ovaries, and I hope you enjoyed it. Bye bye.